You went to bed last Tuesday feeling mostly okay, a little tired. Some muscle aches you wrote off as overdoing it in the yard. By Thursday morning, the fever had started, and you thought, flu. You took some ibuprofen, drank some water, and figured you would ride it out. You have done it 100 times. That decision, right there, is exactly what this video is about. Because for some people, it was the right call. The flu passed, they felt better, life went on. But for others, what looked like the flu on Thursday was something else entirely. And by Sunday, they were in the intensive care unit with their lungs filling with fluid, wondering how a little muscle ache turned into a breathing machine. My name is Dr. Elizabeth Monroe. I spent years working in internal medicine in Boston before coming home to the mountains of North Carolina, where I've cared for rural patients in Appalachian clinics for more than 2 decades. My mother was a community hospital nurse, and she used to say that the most dangerous thing in medicine is not the rare, dramatic emergency. It is the ordinary-looking one, the one that sits in the waiting room looking like everything else. That is Hantavirus. And in the next 20 minutes, I am going to give you the information that can mean the difference between catching this in time and never seeing it coming at all. Before I go any further, drop your city or country in the comments below. I read every single one, and it genuinely shapes the topics I cover next. Here is the single most important thing I want you to understand today, and I am going to come back to it several times before this video ends. It is not the flu that kills you. It is the 48 hours you spent waiting for it to pass. The virus does something very specific inside the body. It targets the tiny blood vessels lining your lungs, vessels so small they are called capillaries, and it makes them leak. Think of those vessels as a series of sealed pipes running through your lung tissue. Hantavirus slowly loosens every seal, every joint, every connection, and at a certain point, fluid starts seeping out. It fills the spaces between tissues. It fills the air sacs. Your lungs stop being lungs. They become, essentially, a wet sponge, and no amount of effort makes breathing feel like enough. The terrifying part is that this process is invisible for days. You feel tired. You ache. You have a fever. You think, I have the flu. And that window, those first 3 to 7 days, is the only window where medicine can actually help you. Once the lungs begin filling, the situation escalates from manageable to life-threatening within hours, not days. The Centers for Disease Control reports that among people who reach the cardiopulmonary stage of this illness, approximately 38% do not survive. That is better than 1 in 3. And for those with pre-existing heart or kidney conditions, the risk climbs higher still. There is no vaccine. There is no approved antiviral. The treatment, once the crisis begins, is entirely supportive care in an intensive care unit. That is why everything I'm about to tell you matters. Now, before we go further, I need to stop for something important. If you are watching this and you currently have a fever, difficulty breathing, or a feeling of tightness in your chest, and you have been in or around a garage, a storage shed, a cabin, a barn, an attic, or any dusty enclosed space in the past 1 to 8 weeks, stop this video right now and call your doctor today. Do not wait to see if it gets better. Tell your doctor specifically, I may have had rodent exposure in the past 8 weeks, and I want to be tested for hantavirus. That sentence could be the most important one you say in a medical appointment this year. If you are experiencing sudden severe shortness of breath, a racing heart at rest, or you feel you cannot get enough air no matter how you position yourself, that is an emergency. Call 911. Do not drive yourself. For everyone else, stay with me. Because what you are about to learn is something most people never hear until it is too late to use it. Let me tell you about Helen. Helen was 67 when she came into my practice. Retired school teacher from a small town in rural Tennessee. Sharp woman, careful about her health, didn't smoke, walked every morning. In early spring, she spent a weekend opening up her family's old cabin, a place that had been closed since October. She swept out the back room, cleared cobwebs from the corners of the storage closet. She noticed what looked like mouse droppings in one corner, cleaned them up with a dry brush, opened the windows. 5 days later, she had a fever of 101, aching muscles, some stomach upset. She called her doctor's office, described the symptoms, and was told it sounded like a viral illness, and she should rest and monitor. She did exactly what she was told to do. For 2 more days, she felt about the same. Then, on day 7, she started feeling short of breath. Not dramatically, just a tightness. By day 8, her oxygen was low enough that her daughter took her to the emergency room. Helen was lucky. The emergency physician asked the right question. He asked about any recent exposure to rodents or dusty rural spaces. When she mentioned the cabin, he ordered the test. She spent 4 days in the ICU, but she walked out. Most people never get that question asked. And I want you to understand why, because it changes what you do next. Hantavirus pulmonary syndrome progresses in 2 completely distinct stages, and the first stage is designed, in a sense, to deceive you. According to Mayo Clinic's clinical documentation, the first stage can last several days, and its symptoms are virtually identical to a standard influenza infection. Fever and chills, intense muscle aches, especially in the thighs, hips, and lower back, headache, fatigue, often nausea, vomiting, or diarrhea, occasionally abdominal pain. Here's the critical detail. There is no cough in the first stage. There is no shortness of breath. There is nothing that points toward the lungs. The virus is quietly working its way into the capillary walls of your lung tissue while you feel like you have the flu. It is not until day 4 to day 10 that the second stage begins, and when it does, it moves fast. The CDC notes that within this transition, coughing and shortness of breath can escalate to respiratory failure within hours. Blood pressure drops. The heart labors to push oxygen through lungs that are filling with fluid. Patients can go from mild shortness of breath to needing mechanical ventilation in less than a single day. If you have ever had a bad flu, you know the feeling of progressive fatigue, day 2 being worse than day 1, then day 3 being a little better again. Hantavirus does not follow that pattern. It follows a cliff pattern. You feel sick. You feel roughly the same. You feel okay. Then you fall off the edge. And that pattern is the most dangerous thing about this illness for anyone over 60, because we are trained by decades of experience to wait out a flu. We have ridden out hundreds of viral illnesses. That instinct, good and reasonable in almost every other context, is exactly what this virus exploits. Type the number 1 in the comments if you have ever waited out something that felt like the flu for more than a week before it passed. Stay with me, because this next piece is the one most people have never heard of until it's too late. This brings us to something even more important, which is where this infection actually comes from, and why the people watching this video are at higher exposure risk than almost any other age group. Hantavirus is not spread between people. The primary carrier in North America is the deer mouse, a small rodent found across much of rural and suburban America. The virus lives in the mouse's urine, droppings, and saliva, and it can survive in dried form in dust for hours. When that dust is disturbed and becomes airborne and a person inhales it, that is how infection happens. Now think about the spaces that adults in their 60s and 70s and 80s are most likely to visit in spring and summer. A storage shed closed all winter, a garage that has not been swept since November, a vacation cabin shut up for 6 months, a basement being cleared for a family move, a barn on a rural property, an attic being organized for a grandchild's estate. The CDC identifies exactly these environments as the highest risk exposure settings: farm buildings, infrequently used storage sheds, seasonal cabins, basements, and attics. These are, almost precisely, the spaces this age group enters and cleans most often, and very often alone. Robert was 72, a retired mechanic from a farming community in western Pennsylvania. He had a small barn on his property where he stored equipment and seasonal items. In late March, he went to organize the barn for spring, pulled boxes from the corner, swept the floor, shook out a tarp that had been folded and stored for months. Under the tarp, a clear mouse nest. He cleaned it up without gloves, washed his hands afterward, and thought nothing of it. 3 weeks later, he came to see me with what he described as the worst flu he had ever had. Fever of 102.8, body ache so severe he could barely get in and out of his car, nausea for 4 days. He had not connected any of this to the barn. I asked because I knew to ask. A blood test confirmed Hantavirus. He was admitted and recovered fully, but not without a very close call in his second week. The incubation period for this virus is 1 to 8 weeks, most commonly 2 to 4 weeks, according to both the CDC and Mayo Clinic. That time lag is precisely what makes the connection between exposure and illness so easy to miss. By the time symptoms appear, most people have completely forgotten the mouse droppings they cleaned up in the garage last month. And there is no billing code for a physician to spend 15 minutes taking a detailed environmental history during a routine sick visit. Most patients are in and out with a recommendation to rest before anyone asks where they have been. That gap in the system is a structural one, and it is one you can close yourself by knowing to speak up. Here is where it gets more specific, and I want you to stay with me because this is the piece that most physicians do not have the time to fully explain. The reason the hantavirus severity is greater in older adults is not simply because older adults are weaker. It is because of the precise mechanism through which this virus causes damage. Hantavirus does not destroy lung tissue the way a bacterial pneumonia does. Instead, according to a comprehensive review published in the journal U.S. Pharmacist and confirmed by CDC clinical guidance, it triggers what immunologists call a cytokine storm. The immune system responds to the infection with such force that the collateral damage becomes worse than the infection itself. Think of it like a fire department that responds to a kitchen fire by flooding every room in the house. The fire gets out, but so does everything else. In the lungs, this cytokine storm causes the tiny blood vessel walls to become permeable. They start leaking. Fluid pours into the air sacs. The lungs become heavy, waterlogged, unable to do their job. This is called pulmonary edema, and at its most severe, it requires mechanical ventilation and intensive cardiac support just to keep the patient alive while the immune system calms down. The challenge after 60 is this. Immunosenescence, the natural aging of the immune system, does not simply make immune responses weaker. It makes them less precise and more prone to inflammatory overreaction when confronted with a novel viral threat. The cytokine storm that hantavirus triggers can be, paradoxically, harder to control in an immune system already calibrated toward chronic low-level inflammation. A systematic review drawing on data from more than 92,000 patients across 30 studies registered in the Cochrane database confirmed that increasing age carries an unfavorable effect on mortality in hantavirus infection. Separate clinical data from PubMed confirm that patients over 60 with pre-existing cardiovascular or renal disease show consistently worse outcomes in both the pulmonary and kidney forms of the disease. This matters enormously for anyone managing well-controlled heart failure, chronic kidney disease, or even moderate COPD. What takes 2 days to become dangerous in a 35-year-old may reach a critical threshold in 12 hours in a 72-year-old whose cardiovascular system is already working at reduced reserve. Think of the capillaries in the lungs as pipes in an older house. In a younger person, those pipes have margin to swell and absorb extra pressure before they fail. In someone whose system is already carrying more load than it should, the margin is smaller. One insult can tip the balance faster than anyone expects. I have watched this play out, and the patients who did best were not always the healthiest coming in. They were the ones who got to the hospital earliest. How old are you right now? Write your age in the comments. It genuinely shapes which details I prioritize in the videos I make next. Now let me tell you about Dorothy, because her story captures something that I think about almost every time I take a patient history. Dorothy was 70, a retired bookkeeper who lived on the edge of Asheville in a house with a detached garage. Over the winter, she had noticed mouse activity in the garage, but hadn't dealt with it yet. In April, she did a full mouse activity in the garage, but hadn't dealt with it yet. In April, she did a full garage clean-out, working most of a Saturday without a mask. 6 weeks later, she came to see me with flu-like symptoms that had lasted 5 days and weren't improving the way she expected. She had not mentioned the garage. It didn't occur to her that it was relevant. I almost missed it. It was only when I was going through her recent activities, partly out of habit built from years in rural clinics, that she mentioned the clean-out. The blood test came back positive for hantavirus antibodies. She was admitted for monitoring and intensive supportive care. She recovered fully. What Dorothy needed in that first appointment, and what the system did not automatically provide, was a physician with the time and specific training to connect a garage clean-out 6 weeks earlier to a flu-like illness today. That connection requires knowledge of the incubation window and a focused environmental history. Most primary care appointments simply do not have room for it. Here's what this means for you. There is a question that separates a hantavirus diagnosis in stage 1, when there is still time to intervene meaningfully, from a diagnosis in stage 2, when the patient is already in crisis. That question is, have you had any contact with rodents or rodent droppings in the past 1 to 8 weeks? It seems simple. It is simple. But according to CDC clinical guidance, it is almost never asked during a standard sick visit, because a physician seeing a 68-year-old with fever, muscle aches, and nausea in a 15-minute appointment has a differential diagnosis of 100 common conditions, nearly all of which are far more probable than hantavirus. The natural clinical instinct is to treat for the most likely thing. That is not a criticism of individual physicians. That is a description of how triage works under real constraints. But a blood test, called an ELISA, which detects hantavirus antibodies, can confirm or rule out the diagnosis in stage 1, before the lungs are compromised. That test exists. It works. It is available in most hospital settings. It is simply almost never ordered unless someone in the room knows to request it. So you become the person who asks. If you develop flu-like symptoms and you have been in a garage, a shed, a cabin, a basement, a barn, a storage area, or any other space with possible rodent activity in the past 1 to 8 weeks, you tell your doctor that immediately. You do not wait for them to ask. You say, I may have had exposure to rodents or rodent droppings recently. Can we rule out hantavirus? That sentence changes the entire conversation. Now let me bring this home with something you can do, because this is ultimately a preventable situation for most people. There is no vaccine for hantavirus. There is no FDA-approved antiviral. Treatment, once the cardiopulmonary stage begins, is entirely supportive in an intensive care unit. That is why prevention is not optional. It is the entire strategy. The virus is transmitted almost exclusively through inhalation of disturbed dried particles. The critical word is disturbed. An undisturbed mouse dropping sitting in the corner of a shed is a different risk than that same dropping swept into the air with a dry broom. The moment you introduce movement, airflow, or agitation into a space with rodent contamination, the risk becomes real. Margaret was 71, a retired librarian from the Texas Hill Country, who had a seasonal cabin she opened every spring. Her habit for 30 years had been to sweep it out first thing, doors and windows thrown open, broom going through every corner. She never thought twice about it. After I spoke with her about this, she changed her protocol entirely. Now she opens every door and window and waits at least 30 minutes before entering, letting cross-ventilation dilute whatever is in the air. She wears an N95 mask and disposable gloves whenever she cleans the cabin, regardless of whether she sees any visible signs of rodents. She wets down any suspect area with a solution of 1 part bleach to 9 parts water before she touches it, a step that inactivates the virus before it can become airborne. She does not sweep dry. and she seals the cabin more carefully every fall because a deer mouse can squeeze through a gap roughly the width of a pencil. Steel wool packed into those gaps and sealed with caulk is a zero-cost intervention that keeps them out in the first place. These are not complicated steps. They cost almost nothing, and they eliminate the primary route of exposure. Here's what you do starting tonight. Step 1. Think back through the last 8 weeks and honestly ask yourself whether you have been in any garage, storage shed, cabin, basement, or rural building where rodent activity was possible. If yes, and if you have had any flu-like symptoms in that same period, write that exposure history down. That information belongs in your next medical appointment, regardless of how mild the symptoms seemed. Step 2. Inspect your home's entry points. Look at the gaps around pipes under the kitchen and bathroom sinks, around the foundation, near any openings where utility lines enter. Mice enter through a hole the size of a quarter. Steel wool and caulk, available at any hardware store for a few dollars, are your first line of defense. Step 3. Before you clean any storage space this season, open every window and door you can access and wait at least 30 minutes before you go back in. Let air move through and dilute whatever is suspended. That one step, completely free, dramatically reduces your inhalation risk. Step 4. Get an N95 mask and a pair of disposable gloves and store them near wherever you would use them, near the garage, in the cabin, in the shed. When you clean any space with possible rodent history, you wear them. No exceptions, regardless of how little you see. Step 5. Write down or say out loud right now the sentence that opens the diagnostic door. I may have had exposure to rodents in the past 8 weeks. Can we rule out Hantavirus? Practice saying it so it comes naturally in the moment when it matters. It is not the flu that kills you. It is the 48 hours you spent waiting for it to pass. I have said that several times today because I want it to be the thing you carry out of this video. Not fear, knowledge. The difference between hantavirus and the flu, sitting in bed on day 3, is almost invisible from the inside. But the difference between knowing your exposure history and telling your doctor versus never mentioning it is the difference between a blood test ordered on day 4 and a ventilator on day 7. You deserve to know this. You deserve the 15 minutes that a standard appointment cannot give you. That is why I make these videos. If you found value in what I shared today, hit the like button. It helps more people in this age group find practical, evidence-based information when they need it most. And if someone you love spends time in cabins, on rural property, or doing spring cleanouts of spaces that have been closed for months, please send them this video. It might be the most useful thing they see this season. I make videos like this every week. If you want to keep receiving this kind of information, subscribe and hit the notification bell so you do not miss the next one. And one last question for the comments. Which part of this surprised you most? The 2-stage progression, the exposure window, the diagnostic gap, or something else? Tell me below. Until then, take care of yourself and take care of someone you love.